Through our networks, we're connected to a lot of professionals who have either immigrated to Canada or have dreams of immigrating to Canada. And we get a lot of questions about where to potentially find jobs. So it's unfortunate, though, that in a lot of different institutions that someone's experience in a different country is sort of undervalued, right? However, I will say for community health centers, the more diverse you are, the more of an asset you could be to a lot of these community health centers. You're culturally aware of customs and practices from your own culture. You might speak the language. Those are the things that can help you stand out. Hello, everyone. Welcome to the Public Health Insight Podcast. Joining me is a very special guest, a world-class, Perva, welcome to the podcast. Partner in crime.
Hello.
How's it going?
Partner in crime. It's good. How are you?
Did you think I was talking about someone else?
It's never been explained as world class. So that was a fun adjective.
Yeah, everybody's world class, and you got your unique qualities to you.
Yeah, fair enough. So do
including
you?
Artistry.
Yes, I did.
No, you do. Not did.
The weekend.
Yeah, but that also like creativity with the drawing and stuff, which is really cool.
Yes.
You still draw?
Oh, I need to get back into it. I need to get back
recently.
into it. I know, it's actually quite sad. I need to.
Yeah.
I miss it.
Yeah, you gotta do it. You gotta nurture those skills. Okay.
But
as far as we know, drawing things isn't on the public health core competencies. However, drawing can be a tool to communicate ideas. So, right? Kind of is if you really think about it. But we're here to talk about organizations that hire public health professionals. So there are many different organizations that do that, and I did put out a LinkedIn post to kind of outline a lot of these, and we won't really spoil it for you. But in this episode, we'll plan to highlight community health centers. And of course, my knowledge is limited to Canada and specifically Ontario as a province in Canada. So the information that we'll talk about will be biased in that direction, but we will share some resources that will point you in the direction of more community health centers across the whole country, if that's something that you're interested in. So in general, what these community health centers are, is they're nonprofit agencies or organizations at the community level that are funded, that have a primary focus on improving the health and well-being of populations. And the focus is on populations that are typically underserved or experience traditional barriers to accessing health services. And people can be marginalized in a lot of different ways. These community health centers work to bridge that gap.
Mm-hmm. And it could include populations that live on low income, could be new immigrants, refugees, those with complex mental health issues, or people who don't have health insurance, people experiencing homelessness. So all of those individuals are often the focuses of community health centers. Now, that doesn't mean that this is exclusively for them. Anybody can access the services of a community health center, but oftentimes the aim is to help and improve the well-being of these specifically traditional populations who face barriers that access the health services in the first place. So kind of what exactly do the community health centers do, Gordon? How do they exactly improve the health and well-being of these populations?
I like the way you explain it, because the way my mind started to go was, okay, so what is the difference between a community health center, for example, and like a clinic? And I guess the idea here is that, Perva, you touched on immigrant and refugee population who are oftentimes coming to countries where it's a different health system, different way of doing things. I mean, heck, people living in Ontario don't even know how to navigate the system, much as someone who's coming from a different health system entirely. So the idea is that community health centers do more outreach to meet people where they're at, versus primary care, sort of a fixed location, and you have to go and find it and seek out services. Community health centers are way more active in outreach, way more active in trying to find different ways of reaching different populations from a cultural perspective. And a lot of the premise behind what they do is to, provide education for families in how to access different types of services. They might provide access to the services themselves. You might have health promotion initiatives built into that as well. And then you're thinking of things like vaccine access. You're thinking of things like programs, diabetes programs. You're thinking about cooking classes even. And this kind of gives insight into the variety of health professionals that might actually work at a community health center based on the nature of work that a community health center does.
I think the way I have always envisioned community health centers functioning is almost like an accelerator to help individuals access things that they obviously have barriers towards accessing. So, obviously, they provide a lot of services and education and advice to these individuals, but they're kind of essentially like a hub. It's a starting point where people who don't have access to a lot of things or don't understand the health system, for example, can go, and the community health center would kind of connect them that,
Right.
this is where you can go to do this. Here are some tools and knowledge that we can provide you to help you accelerate that accessibility to that. And oftentimes they can come as not necessarily just health services, but almost as small as finding some workplace security or connecting you to a community center where you might be able to have a more holistic approach to your health. So it's not just like a more socioeconomic approach and a holistic approach to health where they can connect you to a whole bunch of different organizations, initiatives that are catered towards your specific needs and get rid of all those barriers that might exist in understanding how to navigate the country or the specific community that you're living in.
And each community has a different system, different demographics of people that live there, different resources. So that's why there's many community health centers across the province of Ontario. There are in many other communities as well, in many other states and provinces. And in Ontario specifically, there are currently 75 as we're recording this podcast. And you
Yeah.
can imagine, though, a lot of consistency might exist across those 75. They might offer very different programming depending on the needs of the community, right? So there might be different linguistic and language requirements, cultural pieces. There might be a different kind of burden of disease depending on the community that the community health center is located in. And therefore, they respond differently to those challenges.
It almost makes me think about how the translation of knowledge also has to be so different for each of these community health centers because you're working with completely different populations or individuals every single time. You might be working in one that's in an urban setting and then move to one that's in a rural setting. And the way that they translate knowledge or communicate with people that are accessing these services is so different.
Yeah, and I would say this too. Through our networks, we're connected to a lot of professionals who have either immigrated to Canada or have dreams of immigrating to Canada. And we get a lot of questions about where to potentially find jobs. So it's unfortunate though that in a lot of different institutions that someone's experience in a different country is undervalued, right? However, I will say for community health centers, the more diverse you are, the more of an asset you could be to a lot of these community health centers. You're culturally aware of customs and practices from your own culture. You might speak the language, and those are the things that can help you stand out when you're looking for jobs at a community health center, when the whole focus is to reach underserved populations in the community. So as much as the other things on your resume are important, like public health experience, project management, this and that, don't shy away from, hey, I speak two different languages. Maybe look, if you're looking to immigrate into Canada, try to find a community that is similar to the one that you're leaving so that you can also be an asset to the community that you're coming into Canada. Speaking the same language, right? Understanding the customs and traditions, understanding what people
Yeah.
prioritize. And compared to someone who's Canadian, who maybe isn't as familiar with that kind of diversity aspect, you would stand out against those types of competition in the job market. So the things that you went to school for are important, but that lived experience piece is highly valued in community work as well. And there's many different
Yeah.
roles that you can attempt to try to get to fulfill that.
Before we kind of go into talking about the different roles, you touched on a really important point that maybe we can expand on further is the cultural competency and intelligence that you bring in from being from another country. But that's amazing, incredibly an asset. But there's also certain skill sets that come with, even if you're working in another country, that knowledge is still applicable to any other place you go to. If you have experience working in rural health in, say, Nigeria, and you have done a lot of outreach work and community work with rural populations, the same understandings and learnings that you've gotten from that specific project or experience will still be applicable to rural settings in Canada. And so, same idea, if you have a lot of experience working with people that have complex mental health issues, then you can still bring that knowledge and apply it to populations here in Canada, while the individuals that themselves might be culturally different. I think the knowledge and the approach with which you work can still be applicable depending on when you're like coming into a community health center, because you're working with people and people will be the same no matter where you go, even if they themselves are culturally and have different backgrounds. So I think that's something that we always should keep in mind if you're coming into a new country or trying to find your way around. But yeah, back to what you kind of said, Gordon.
But that's a good point. So I want to flag this. So there's a bit of a conundrum there. And the conundrum is, yes, your experience on the ground is valued. And if given a chance, you will likely shine, right? You've done a lot of great work in the country that you're coming from. Who better to do that work in Canada with similar populations than you? Yes, yes, yes. The challenge becomes in getting that job in the first place, right? So what I find in talking to a lot of folks who have dreams and aspirations to coming to Canada is that they have a difficult time kind of Canadianizing their resume. In a similar way that if I went to work in Ghana or Nigeria, the way I do my resume and talk about things might not resonate with people there either, right? So it's not right. So it's not necessarily a bad thing. It's just the way we've been cultured to think in Canada about what a professional looks like. So the way to overcome that barrier and kind of have your resume be seen, because you make your first impression on paper when you're applying for jobs most times, is to spend time listening to podcasts like these, going to different webinars, connecting with people who might be able to help you, connecting with colleagues, and try to frame your resume from a Canadianized or from an Ontario perspective. And a lot of that of what you can do comes from even just looking at the job posting, what types of terminology and words that they use to describe something might not be how you describe it back in your country, but you'd have to kind of mold it to what they're expecting you to talk about from a Canadian context. And I think that's where most people struggle with. Once they get the job, they blow the minds of their employer and they do really well, but it's just not getting that chance in the first place. So I just want to encourage people that there's sort of two battles that you're fighting there: getting the job and then excelling in the job. You all have what it takes to excel in the job, but there's a little bit of tweaking that needs to happen to get the job in the first place.
Very fair point. Yeah, so there's a lot of roles that are often hired into community health centers. One that Gordon himself is a major expert in is a health promoter or health promotion facilitator. Similarly, maybe community health promoter. Gordon also mentioned that it's an incredibly diverse area of work. So you can even have individuals that are nutritionists or a dietitian. That's a completely different skill set and education actually than a health promoter is. If you're working, and I think if you are in a community health center or a department in the community health center that's a little more focused on specific populations, then you might have harm reduction workers working there or overdose prevention support workers. So I think there's a big diversity in who can work at community health centers, who often does work there. I know social worker, I feel like, is also one that's super popular. You see, if you find social workers really anywhere, but community health worker or community health centers especially.
You know what? Social work, if I had to go back and do school again, I would have strongly considered education and social work. because it's like a two for one. It's a regulated service provider, right? You get registered through a college of social work and you get a license number and you get held to high practice standards in that sense. And also, it's a similar kind of teachings and concepts as public health. So, in public health, a public health background, you're not necessarily a regulated health provider unless you have another educational background like nurse, doctor, etc. But for those folks who are considering doing a degree, an undergrad degree, social work is a good one to consider.
Yeah. It's also whatever you can make it. That's
Yeah,
another part to
exactly.
see.
You touched on a couple different roles, Perva. A lot of it revolves around health promotion, right? So obviously,
Yes.
at a community health center, a lot of what goes on there involves service delivery. So you might have oral health services, right? So we didn't even really get into dental hygienists or dentists, and things like that, because oral care is a huge part of what you need to be healthy, right? So those are services or interventions. And then you have like the prevention side of things. So community health centers not only get involved with, oh, there is an issue with something and let's treat it while it's a problem. Community health centers also are involved in identifying risk factors, engaging in prevention work, and a lot of that is centered around health promotion. So there's health education, teaching, community engagement to understand what a community might need to understand about a given health issue, to work with the community to address issues that are concern them by working with them, right? And we touched on something like diabetes programs in the past. Obviously, diabetes treatment, yes, very important, but also diabetes prevention. And that's kind of the work of health promoters as well, working on a multidisciplinary team. Perva mentioned a variety of different roles. And so if that's something that interests you in terms of working with a variety of health promotion, working with a variety of health professionals to provide robust and comprehensive supports in health for a community, this might be a good place to look.
Yeah. You just become such a well-rounded individual in work settings like this, I think. Because even if you're working on a very specific project or population, you're working with such diverse expertise that you're bound to kind of absorb some of that knowledge and skill sets and even competencies that they might be sharing into their specific jobs.
Just to go back to the types of jobs. So, yes, things like dietitians, dentists, dental hygienists, nurse practitioners, those are regulated health professionals that require license in the province that you're practicing, right? So there's a limitation to folks with a certain educational background and where they got the education that are even eligible to do those roles. However, there's roles that don't rely on even a specific type of degree. So when you look at something like peer navigation, care coordination, systems navigation, those roles are all about how do we take the assets that we have in the community about the different services and entry points and then communicate that and help people navigate that in a way that's not as frustrating, right? Everything's in English, for example. What if you have a non-English speaker, right? How do you kind of get people to where they need to be to get the services that they need? And those roles don't often require a very specific type of kind of higher education. Those roles depend more on like experience that you've had. So if that's an experience that you've had outside of even the Canadian context, if there's a way for you to communicate that on your resume, it would go a long way to getting these types of roles. But I say that to say, in general, there's skills and different competencies that more or less every role at a community health center needs to be successful. And Perva, you were going to get into some of those.
Yeah, and some of these might seem general in a way, but I think they're key skills and competencies that really excel the role that you might play in a community health center. So, of course, we've got diversity and cultural competency and intelligence. We touched quite a bit on this earlier in the episode, but something like that is a non-negotiable. You need to have that working with diverse populations and multicultural individuals, you have to be able to have that competency and intelligence there. Similarly, Gordon just talked about communication. Specific roles like patient navigator or systems navigator, KT, like knowledge translation and communication is such an integral like skill set for those. You need to be able to communicate clearly and efficiently. Of course, public health sciences, you're working in a public health space, having an idea of that was great. And then Gordon and my favorite is the program planning, implementation, evaluation. How can we make this work better for not just us, but also those that we serve? And having the ability to analyze and then act on the takeaways from those analyses is really important. It continues to, you can constantly shift your services to better cater to who you're working for and to, and providing the services to. What are some other ones, Gordon? Maybe you can touch on those.
Yeah, and I would say too, there's a lot to unpack within each of the skills and competencies that you mentioned, Purva. Like I'm thinking about program planning, implementation, evaluation, and even within that, something I'm gonna discreetly say something like grant writing, right? So
Yeah.
as you can imagine, pretty much every health service is underfunded because things get worse and you don't get money proportionally to how things get worse. You kind of have to make do with what you have, and you have to do more with less in a lot of cases for community health centers. So a cool way to supplement the funding that an agency has is through getting grants. So if you have skills in whatever country or wherever, if it could have been outer space that you were getting grants, that's a transferable skill, right? So that knowing how much budget you have can inform program planning, of course. And obviously, to be accountable to funders, you have to have a strong view towards implementation and evaluation and reporting back on various performance metrics, et cetera, et cetera. So that's important. And I also want to tie this into something that I've been learning a lot more lately about this idea of a learning health system, right? The idea behind a learning health system is that through a learning health system, you have, research that's generating data. That data is going to get converted to knowledge. The knowledge goes to practice. When you practice and do things and implement things, you learn more about that thing that generates data, and then you use it again to improve things. So you go through a little cycle here, and it really ties in all the different skills and competencies of leadership, communicating ideas, advocacy as well, right? So advocating for populations that you work with, and having a key understanding of even beyond population level health, understanding that in the context of the system in which everything exists. So how funders work, how the health system works, what do you need to do to streamline things, what do you need to do for quality improvement, what do you need to do to share that there's a greater need, how to advocate for that. So everything kind of ties together, and that might not be in the scope of your role at a community health center, but having one or several of these can help you stand out if you effectively communicate how you exemplify these with examples. So I just wanted to end by saying too, it's not enough to just list them on your resume to say that you have them. You should be able to speak to examples that demonstrate that you are adept at these things.
Yeah. I just think community health centers are such a great first foray into public health. You just learn so much, and you're working directly with populations that have trouble accessing healthcare.
Right.
You really get down to the nitty gritty and really understanding the needs of various populations and individuals. I think it's a really good starting point. And a lot of them also often look for volunteers.
Yeah.
So even if you're not maybe looking
workers?
for a job right now, yeah,
Sometimes.
great volunteer space. Yeah, great volunteer space to learn a lot. Yeah, I think it's a
And I
great
would
way to
even
start.
say, so starting, yes, but also some people, this is their jam, right? And the reason it's their
absolutely,
jam
yeah.
is because, and we'll get into this in subsequent episodes, depending on the type of organization that you work for in public health, the further removed you are from direct contact with the populations that you serve, right? So
Yes.
If you're someone that gets energized by directly seeing and interacting with people that you desire to have an impact on, community health centers, whether it's a start or end, might be the place where you
Yeah,
feel the most comfortable. If you're getting to
absolutely.
like federal government roles and provincial and state,
Mhm.
you're meeting with people, you're arguing about funding and different things, and oftentimes, if I'm being honest, you lose sight of the people who are meant to benefit from a lot of what the work is going
Mm.
on. So if that's something that energizes you, something that makes you feel like you're at your best, community health centers are a great shout.
Yeah. And they really are irreplaceable. Honestly, community health workers bring so much valuable insight. And even whether you're starting off or you've been there for a long time, I think it's just their knowledge that they hold with the populations they work with is quite literally like lived
Mm-hmm.
experience that they get to see and observe. And there's a reason why community health workers are important stakeholders no matter where you go in public
Mm-hmm.
health. So, yeah,
Absolutely.
that's my 2 cents.
If you enjoyed this episode, there's more to come. We're going to talk about health units. We're going to talk about international organizations, NGOs, government, global health organizations, blah, 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 many, many more. So if this is something that you enjoyed us covering, stay tuned for more. For now, Gordon, Perva, signing off. Peace.
Bye.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.